Hi everyone, Dr. John Schott, physical therapist here at Balance Physical Therapy. So today let's talk about ankle sprains. They can happen in a variety of ways. You could simply be on a hike or a walk and you step on a rock and your ankle all of a sudden turns inward. Or you could be playing a sport like basketball or soccer. You jump up for a ball, you come down, land on somebody's foot, and all of a sudden you sprained your ankle. However you sprain your ankle, it hurts and it can take some time to recover. So let's take a quick look at the anatomy of an ankle sprain. So we have ligaments all over our foot, and their purpose is simply to bring support and stability to the ankle joint. With what we call an inversion ankle sprain, the most common involved ligament is the anterior talofibular ligament, also known as the ATFL. It attaches from a bone down in our foot called the talus, and then up to our fibula, which is the most lateral bone in our lower leg. Another ligament that can be involved is our calcaneofibular ligament, which goes from a bone in our foot called the calcaneus, which is basically the heel bone, and then up to the fibula. So we can see that when our ankle is forced inward, especially with a significant amount of force coming from our body weight coming down on it, it can put some serious stretch on the ligaments in the lateral aspect of the ankle. And when we have an inversion ankle sprain, we'll often see that we get swelling and reduced ability to put weight through our foot. It can take a while for your ankle to feel normal again. And part of the reason for that is when ligaments are injured, it can put a permanent stretch on those ligaments that reduces the stability in your ankle. Secondly, ligaments do not have the blood supply like your muscles, so when they are injured, they aren't getting the blood flow they need to bring in healing properties to help them in the recovery process. One of the most common questions I get is, what should I do when I sprain my ankle? And the answer is keep moving. Do not simply ice and rest your ankle. We want to optimize the healing process by reducing swelling and increasing blood flow to that region. And the best way to do that is through movement. So start with simply propping your leg up and moving your ankle back and forth, side to side, and even try to write the alphabet with your foot. Do this to the amount of movement that you can tolerate, but you'll notice with time as you start moving it, it will slowly get easier and easier for you to do more repetitions and it won't hurt as much. This will also help to keep the ankle joint loose because if you rest and avoid movement, it will become stiff over time. Once your foot feels more mobile you can tolerate weight, now we can start with some body weight movements. Start with simple weight shifts, moving your weight side to side through each foot, and then we can start with active movements with your ankle joint loaded. Slowly raise up onto your toes and slowly come back down. Focus on keeping these movements slow and controlled, both with lifting up and with lowering down. As you progress along, you can start doing exercises in the single leg position and even on uneven surfaces. In order to help prevent ankle sprains from happening in the future, you want to keep up with regular strength training for your hips as well. Your hip musculature helps control what is happening all the way down to your knees and your ankles. They provide support and stability to the entire lower extremity. So remember, if you sprain your ankle, don't just rest in ice until it feels better. Movement is medicine, so stay active to optimize your recovery. If you like this video, remember to click like and follow us on Instagram and Facebook for similar posts on injury prevention and recovering from injuries.